Good afternoon. Welcome to the Homes Within Reach 2021 session on Framework for an Equitable COVID-19 Homelessness Response. My name is Angela Sustin, and I am the Homeless Program Manager at the Pennsylvania Department of Community and Economic Development, and I will be your facilitator today. The Framework for an Equitable COVID-19 Homelessness Response, created in partnership between the National Alliance to End Homelessness, the Center on Budget and Policy Priorities, National Low-Income Housing Coalition, and the National Health Care for the Homeless Council, is intended to support communities to address both the public health and economic crises created by the COVID-19 pandemic. These crises are proving to be long-lasting and disproportionately impacting people experiencing homelessness, Black, Latinx, and Indigenous communities, and people with disabilities and/or underlying health conditions. Homelessness assistance systems, which are strained in normal circumstances, are struggling to keep up with demand and to be incorporated sufficiently into community-level public health and economic recovery activities. This framework provides guidance to communities on prioritizing actions and using a wide range of federal funding sources to meet public health goals, address economic impacts, increase housing stability, and prevent future increases in homelessness, all with a racial justice and equity lens. Here today to talk us through the framework is Dr. Joe Savage Jr. Joe is the Regional Coordinator, Mid-Atlantic and Southeastern states of the U.S. Interagency Council on Homelessness. Joe is a recognized leader with over 15 years of experience in the fields of homelessness, social policy, economic development, and human services administration. His prior work experience encompasses positions in which he was responsible for overseeing transitional and permanent supportive housing programs, continuum of care funding, strategic planning, and coalition building. His passion for this work has cultivated years of skills and experience that have helped bring over $150 million of funding to support housing and services for the homeless and community development projects. Joe's commitment to this work is rooted in his belief in the dignity of human life. He received a master's degree in social work and urban planning from the University of Pennsylvania and a PhD in urban affairs and public policy from the University of Delaware. It is my pleasure to introduce Dr. Joe Savage.
Thank you, Angela, and welcome everyone to this session on the framework for an equitable COVID-19 homelessness response. As introduced, my name is Joe Savage. I am a regional coordinator with the United States Interagency Council on Homelessness, and I serve the Mid-Atlantic and Southeastern states. So I'm pretty much your liaison between, the provider community as well as local and state governments and the federal government. And this is my contact information. Please definitely take down my email address if you need to reach out to me for any reason. And it figures UPS would come right when I start talking, but I'll let them go ahead and leave the package. But take down my email address. And that way, if you have any questions about any federal policies, any funding questions coming out of HUD, the VA, or Department of Education, certainly reach out to me and I'll do my best to connect you to the proper persons or to answer the question myself. So basically what I want to do is I want to go over the framework in general and give you an overview of it. And then Angela is going to speak more specifically about activities and works that's being done at the state level in Pennsylvania as it relates to this particular framework. And as Angela mentioned, this framework was developed in partnership between the National Alliance to End Homelessness, the Center on Budget Policy Priorities, National Low-Income Housing Coalition, and the National Health Care for the Homeless Council. And these particular agencies have developed this framework. Hold on for a quick second. I do apologize. I think this is my son's meds that UPS is delivering, and I have to sign for this. Just give me 1 minute. Hello? Okay, I'm sorry about that. I'm back. So basically, these agencies came together to develop this framework, and essentially it was developed in response to COVID-19, as you can see. However, it was developed to address the public health as well as the economic aspects and impact of COVID-19 on homelessness. However, these partners felt that it was important that this framework be developed through a racial equity lens. And as many of you may know, recently, it's become a federal priority for us to look at the disparities that exist within the homelessness system so that we can make sure that there aren't populations who are being disproportionately impacted. And if they are, that homelessness systems are designed in such a way that they are addressing those racial disparities. So this particular framework is really going to walk you through some strategies to respond to both the public health and economic crises developed by COVID, but to do it through a racial equity lens. So what I'm going to do, I'm going to talk about the general framework and how it's outlined. And essentially, it's broken down into 5 action areas. Action area A focuses on unsheltered homelessness. Action area B focuses on shelters. Action area C focuses on housing. Action area D, diversion and prevention. And then action area E, strengthening systems for the future. And so the way that the framework is organized, each of these action areas have 5 key priority elements. And then within each of those priority elements, there are a number of strategies. So the way that I'm going to do this, I'm going to go through each action area. I'm going to look at the priority elements within those action areas, but I'm only going to mention a couple of the strategies because some of the priority elements in these action areas have 10, 12 strategies, and we don't have enough time to go through all of those strategies. So let's go through the action areas, the priority elements for each action area. And as I mentioned, I'll mention a couple of strategies for each of those priority elements. So action area A, unsheltered homelessness. So these are the 5 priority elements. And if we look at that first one, implement immediate emergency protective measures to address the public health crises. Some of the strategies that are listed under this priority element as it relates to unsheltered homelessness are ensuring that there's access to low barrier non-congregate shelter options. So you're following CDC guidance, you're developing and opening non-congregate shelters, but they are low barrier, meaning people don't have to jump through a lot of hoops in order to access this shelter, whether it's IDs or if it's a shelter that might require marriage certificates, if it's a couple, etc. But immediate access to low barrier non-congregate shelter options, and they are following CDC guidance as it relates to non-congregate shelters. And then also another strategy under this priority element is following CDC guidance as it relates to clearing encampments. This can certainly apply to many urban areas, but also rural areas as well. And essentially CDC guidance, we don't want you to clear encampments if there is not an alternative that is readily available. And then finally, engaging people with lived expertise from all subpopulations and demographics within the unsheltered homelessness population so that they are involved in planning this immediate response. All right, priority element number 2, scale and strengthen response to public health crisis and add a focus on economic crisis. So some of the strategies underneath this priority element, ensuring and monitoring the full reach of screening efforts for unsheltered persons and providing access to testing. So making sure that they have that access and so that certain subpopulations within the unsheltered homelessness population, they're not being excluded from testing or access to healthcare. And then also supporting people who remain unsheltered. As many of you know, some people, they're not immediately willing to come into shelter. So ensuring that you are providing support to those who remain unsheltered and that you're assisting them in implementing safe social distancing measures, sanitation, hygiene, as well as harm reduction practices. Number 3, sustain and continuously adapt response based upon changing public health and economic conditions. Some of the strategies listed under this element area. We want you to continuously adapt your outreach and engagement strategies to provide access to technology. This is very important, particularly for the unsheltered population. As you know, a lot of access to healthcare as well as a lot of other services due to COVID-19 is being done remotely. So making sure that in whatever services, whatever outreach you are providing, that they're having access to the necessary technology so that they can access those services and those resources as well. And then providing and sustaining safety and protective measures for any people who remain unsheltered. All right, number 4, build a system to immediately end any experiences of unsheltered homelessness. A couple of the strategies here, developing a comprehensive understanding of who is homeless and what their services are. So you're not only doing outreach, but you're also making sure that you're using people with lived expertise to identify all unsheltered population. And then you're providing the necessary resources so that you can bring an immediate end to their homelessness. And of course, this is all going to be data-driven so that you know what resources are needed. And then number 5, use funding strategically throughout the response. This is a priority element that's in each action area. I won't go through any of the strategies here, but many of you may know there are multiple funding resources, from CARES funding to CDBG to state and local funding, just making sure that you are coordinating those funding sources so that they are being used strategically. All right, so action area B, shelters. And again, we see the 5 priority areas. They're going to be similar for a couple of these action areas, but they will differ for others. So as far as number 1 is concerned, implementing immediate emergency protective measures. Some things related here as far as strategies are concerned for shelters, implement COVID-19 screening and testing protocols. And you want to be able to assess the needs and prioritize people based on their level of vulnerability. So you want to make sure that in terms of non-congregate shelter, that you have your system designed and your shelters designed so that there are safe places for people to quarantine, safe places for people who don't have symptoms, and so that you're following CDC guidance in your shelter implementations. And then again, with access to shelter, you want to make sure that it is equitable, so that no one is going without access to shelter and they're facing barriers, and those barriers can be primarily related to either their race or ethnicity or even disability. Priority element number 2, this is similar to action area A. And so a couple of the strategies here is that you want to be able to assess and determine whether or not people do have equitable access to shelter resources. And you want to make sure that Black, Latinx, as well as other indigenous populations, and then also within whether it's urban or rural areas based on gender identity, that people are having access to the necessary public health and economic resources that they need. Priority element number 3, sustain and continuously adapt a response based upon changing public health and economic conditions. And so here, if you're thinking about your system and the response that you have done with shelter, as far as non-congregate shelter, testing protocols, even the safety of the staff, being able to have places for people to quarantine, you want to be able to sustain those plans, but you also want to be able to continue to look at your data so that you can adapt the response based on what's happening with COVID in your particular community. So understand it's all very data driven. And I know in a lot of communities, folks had difficulty connecting with their local Department of Public Health. So hopefully those things have been improving so that you can constantly monitor data and be able to adapt your system. And then number 4 is important, and those first 2 words, reimagine and transform approaches. So we've seen it across the country. COVID-19 hit and we had to totally transform our shelter system and how that shelter system operates. And what's key to this is really making sure that those key decision makers are really at the table when you are doing the planning and the implementation. You're also listening to the voices of people with lived expertise so that you can understand understand where your shelter system needs to shift and how it needs to change its operations. If those key decision makers are at the table, when a policy change needs to happen, it's able to happen a lot quicker when those people are actually at the table making those decisions. So it's very important that we're able to reimagine and transform our approach to emergency shelter. And then, of course, number 5 is about using funding strategically, whether it's ESG, ESG cares, as well as any other type of state and local funding for shelter, even philanthropic funding, making sure that all of those resources are being used strategically for shelter. All right. Action area C. This action area is related to housing. And as you can see, priority elements 1 through 3 are the same as action areas A and B. And then we differ as, and number 5, and then we differ when we get to number 4. So I'm not going to read each element, but I am going to talk about some of the strategies under housing. So when we talk about housing and we're talking about priority element number 1, we really want to make sure that we are continuing to house as many people as possible. I know a lot of communities have developed non-congregated shelters, and they've gotten unsheltered people off the street, and they've also made it so that people who are currently in shelter can be able to quarantine, etc. But one of the things we want communities to remember that the focus is still on housing and making sure that people have immediate access to not only the protective measures within shelter, but that the focus is continuing to be on housing. And so when we talk about number 2, this is going to tie into number 5, using those funding resources so that you're able to scale your housing to the level that is necessary. And we know that communities across the country are strapped, that funding resources aren't adequate. So this is why it's really important to strategically use and coordinate those funding resources, and then also prioritize people based on their level of vulnerability, really using a coordinated entry system to determine what your housing needs and what your housing resources are within your community. So again, you're using data, but we also want you to look at that data if we're talking about scaling and strengthening and then even sustaining and adapting your housing response. Looking at that data to say who is accessing the housing, who is in emergency shelter, who's unsheltered, who's accessing the housing, and you want to make sure that it is equitable, that there isn't a particular race or ethnicity that is accessing housing at a faster rate than others. You also want to look based on gender identity. So we really want you to look at your data so that you know what housing resources you need, where you need to scale, where you need to build up, but also who's accessing the housing. And we want you to break that down based on race, gender, as well as sexual identity. And HUD has released a number of resources. The National Alliance to End Homelessness has released a number of resources to really help communities do this racial equity analysis of their homelessness response systems data. All right, and then I think number 4 is pretty much self-explanatory in terms of the scale and range of housing options. So with COVID, a lot of communities are finding that, you know what, we have to put all types of housing on the table, even if it's shared housing, some form of shared housing. How can we use those funding resources to implement shared housing? And of course, landlord engagement and recruitment becomes key in this area. And so you really want to be able to develop those relationships because, again, we're trying to move people into housing as we're responding to COVID-19. And again, this particular framework, all of these priority elements, they have a number of strategies, and you can actually access this particular document and it does get updated. So if you want to get the latest copy of this framework, the website is housingequityframework.org. housingequityframework.org. And if you go to that website, you can always access the latest version of this framework. And again, as I mentioned, these priority areas that I'm mentioning have a number of strategies. So please go access the actual document and you can get into those strategies. Because as I mentioned, we don't have the time to do that here in this session. And then action area D. So we focused on the unsheltered population, then we focused on shelter, and then action area C focused on housing. And now we're going to action area D, which is diversion and prevention. And again, if you access the framework, you can get the strategies under these priority element areas. The key thing that I want to emphasize with diversion and prevention as it relates to racial equity, you really want to make sure that the information about diversion and prevention resources, whether it's rental assistance, whether it's mortgage assistance, whether it's employment assistance, that information is really getting out. We heard from a number of communities that when the eviction moratorium went out, when new rental assistance due to COVID was going out, that persons of color were not the ones accessing the assistance because they did not know that it was out there. So if we're going to do this work from a racial equity lens, we really have to make sure that those who need the assistance the most, and we want you to look at your data, who's in your homelessness system. So if you're finding that those who are coming into the system are African American, but yet when you look at your diversion and prevention assistance, that African Americans aren't accessing that assistance, you have a disparity there. So your community really has to make sure that these resources are getting pushed out so that those who need it, those who are accessing it, that everyone in the community has equal access to these resources. And that is the main point that I want to emphasize here, simply because this is something that we have heard from a number of communities as it relates to racial equity and access to diversion and prevention resources. And so again, I want to emphasize here, making sure that the information is getting out about eviction moratoriums, et cetera. And then even when we talk about this particular action area, we know that the national moratorium is going to expire at the end of this month if it is not renewed. If that is indeed the case, working with your local county or your local city, whatever that form of government may be, to get an additional moratorium enacted to prevent people, because that's one of the big concerns when this moratorium expires, the influx that we may see because people have been impacted economically due to COVID. So again, if the moratorium expires, making sure that you're working with those key decision makers to have one implemented locally, and then also making sure that the information about the diversion and prevention resources, that information is getting pushed out so that it's equally being accessed by everyone in your community. All right, and then action area E, strengthening systems for the future. So again, if we're talking about approaching our response to COVID-19 through a racial equity lens so that we have an equitable response, we just don't want to do this because COVID is here, and then once COVID is over, you know, and hopefully we will get to that point someday, that then things go back to how they were. No, we really want you, what you're doing in response to COVID and a lot of the systems change that you're implementing, and then a lot of the racial equity work that your community may have already started to do, we want that work to continue. We want you to be able to continue to center a racial equity lens and focusing on housing and racial justice within your homelessness response system. We want you to continue to improve your outreach efforts, improve access to shelter for those who are unsheltered, improve your community's policies in response to dealing with encampments in a safe and in an equitable way. And then we want you to also continue to use your funding resources strategically. You know, we've been doing well with getting those resources out for veterans, and we're seeing some good increases in continuum of care program funding. And so hopefully we will be able to continue to see these increases in funding so that we can give you all additional resources. But again, it's going to take your entire community to come together to coordinate and to collaborate around developing this response so that these funding resources are being used strategically. However, the thing that I do want to emphasize when I'm talking about these key decision makers, whether it's any of these action areas and this final action area as well, you must involve people with lived expertise. they have to be at the table. And those people with lived expertise have to be representative of the homeless population in your community. And it's not a measure of just having a token person with lived expertise, but they are giving real decision-making authority, just like everyone else at the table. And if it is a situation where they are being compensated, pizza is not a compensation. You want to compensate them financially just as you would do any other consultant. So in this planning and in developing this system so that you're going to have an equitable response to the impact of COVID, and we know that COVID is disproportionately impacting the Black as well as other minority communities. And so we really want you to look at your response that you've been developing. Who is accessing testing? Who is accessing shelter? Who is accessing healthcare resources? Who is accessing diversion and prevention resources? So again, this involves really looking at your community's data to understand and break it down by the demographic populations. And again, I can't emphasize this enough. Throughout this planning process, throughout this implementation process, and even the evaluation of your system so that you can figure out how do we strengthen and continue this system, you have to involve people with lived expertise, and you want to involve them in a genuine and real way. All right, so these are the 5 action areas. As I mentioned, they have these 5 priority elements within each action area. Go to the website to download the latest copy of this framework, because as I mentioned, those priority elements have a number of strategies within them, and it's just too much to go through here. And then here are some additional resources. And I do believe you all will be able to get a copy of this PowerPoint so that you can have access to these resources. And so Angela, I'll turn it over to you.
Great, thank you, Joe. Let me switch gears and share my screen.
Angela, I found that I had to click on my PowerPoint to make it advance. I couldn't use my arrow buttons. I don't know if that's the same for you.
All right, thanks. Are you able to see my screen now?
Yeah, we can see it.
Wonderful. Okay, so just to give a little bit of background to you on the Pennsylvania Department of Community and Economic Development and the homelessness unit that I oversee as the homeless program manager. We are the collaborative applicant for the HUD Continuum of Care, funding for the East and West CoCs, which cover a total of 53 counties throughout the Commonwealth. We are also the state recipient for the HUD Emergency Solutions Grant, or ESG. And we're also the HMIS lead for 4 of the 16 CoCs throughout the state, including the Eastern and Western CoC that I mentioned earlier. And for those in the audience that don't know, I'm sorry, I'll try not to use too many acronyms. HMIS is Homeless Management Information System. So I wanted to talk a little bit about the CARES Act and specifically the Emergency Solutions Grant, or ESG funding. So the relief bill that was signed last year provided $4 billion nationally for the ESG program. And those funds were intended to be used to prevent, prepare for, and respond to coronavirus among individuals and families who are homeless or receiving homeless assistance, and to support additional homeless assistance and homelessness prevention activities to mitigate the impacts created by COVID-19. Pennsylvania Department of Community Economic Development, DCED, received a total of $39 million or $39.8 million in ESG CARES Act funds that we call ESG CV. The first $19 million was allocated in July of last year, and our second tranche will be allocated in March of this year. And just wanted to let everyone know that the application is open as of this past Monday for that second round of our ESG CARES Act funds. Here's a breakdown of the ESG CV round 1 funding and the activities that were funded. Majority, a little over 60%, did go towards homelessness prevention. And you can see the breakdowns here then in the other components of rapid rehousing, street outreach, and emergency shelter, as well as HMIS and administration. So one thing with our ESG CV round 2, this past November, we released an RFP specifically for what we called Code Blue, which was winter sheltering for the winter months of 2020 through 2021. And we awarded $2.9 million to 15 grantees throughout the state of Pennsylvania who will provide emergency shelter, temporary emergency shelter, and street outreach with those funds. And this really aligns with the ESG CV Code Blue framework because in the elements that Joe outlined in his presentation, it states that you should determine whether any seasonal shelter options will not be available to operate during the winter months and identify strategies for replacing any lost sheltering capacity in order to be prepared for changing needs during the winter months. And so our Code Blue funding through ESG CV really aligned with the framework to allow communities to increase their winter sheltering. So I think it's important when we talk about equity and just look at the data nationwide, that there is an overrepresentation of Black, Native American, and Latinx people in America in homelessness numbers, and this is nationwide. So Black people are 13% of the entire population, but 40% of those experiencing homelessness. Native people are 1.3% of the population, but up to 10% of those experiencing homelessness in a number of states. And Latinx identified people are 18% of the population, but 22% of those experiencing homelessness. And also disparities in COVID-19 deaths among Black, Indigenous, and people of color, as well as disproportionately among those experiencing homelessness, mandates the need to place equity at the foundation of our homeless response system. In our ESG CV2 application guidelines, as I mentioned, that were just released, we have asked applicants to appropriately address racial equities in planning and procurement. We're asking that they engage organizations in service delivery to include smaller community-based organizations and those led by people of color. We're hoping that this request will reduce barriers reported by those providers in existing procurement processes, including smaller overall budgets, less access to funding, and less access to government grants. We're hoping it will increase the availability of culturally appropriate services in areas of need and ensure services are delivered by organizations best equipped to meet the needs of marginalized populations and communities that have been disinvested in. In ESG CV2, we will continue to promote engaging unsheltered homelessness and expand shelter. One thing is that we are allowing direct entitlement communities to apply for street outreach and emergency shelter, which is something that previously entitlements could only apply for rapid rehousing and homelessness prevention. And when we look at the phases that Joe outlined in his presentation, we really want to move into phase C in that housing of the framework to continue to house as many people as possible. So really promoting rapid rehousing and the use of homelessness prevention financial assistance with our ESG CV2 funds. So this is the team. I just wanted to quickly put up our contact information. This is our homelessness program team at DCED. Please feel free to reach out to any of us at any time. I'll leave this up for a moment, but I will turn it back over. We'll see if there's any questions in the chat or if Joe has anything else to add at this time.
One of the final things that I will add as it relates to COVID and the vaccine, just to let you all know, USICH, along with our other federal partners, we have been working with the CDC to ensure that homeless individuals and families will be considered a priority in the distribution of the vaccine. And so I just wanted to let you all know that you should be, just hearing from your state or your local Department of Public Health as far as these priorities are concerned. But we are at the table and we are pushing for, equitable access for our particular population. And as far as the questions go, Brian would be responsible for facilitating those. So there is a question in the chat box. The newest relief money should be here soon. How can the government play a role in making the funds more equitably distributed? Angela, do you want to take a stab at that as far as the state is concerned? And then I can address that in general.
Well, I think with the relief funds that are going to be coming available, we're still uncertain at this point, how, what the plan is for distributing those funds, right? The rental relief funds, I think, is what the question is relating to. But what's going to be important, I think, is making sure that those entities within communities or organizations within communities that are responsible for making sure that those funds get into the hands of households to keep them in housing, that you're doing the same thing that we are, at ESG, and looking at, those organizations that are well tied into the communities that are, underserved, and that those that are, focused on serving those Black, Indigenous people of color, I think is going to be important. Just a collaboration among different organizations within the communities to do outreach and get those funds out to those different populations will be critical.
Yeah, and basically making sure that, particularly if it's an entity of local government, making sure that you are partnering with the CoC to understand how those funds are being distributed. And then particularly, if it's an urban area or even a suburban area, a lot of local communities have neighborhood groups and organizations that actually work with the local government, work with the local city council. So local governments can make sure that they're using their network with community and neighborhood watch organizations to get this relief information out, so that your minority as well as your Indigenous populations are aware that this type of assistance is out there. So that is another way that governments can work with the local community to get this information out. All right, another question. Do you have suggestions to keep this work going post-pandemic, given there might be less money, resources, and support? My number one thought to that is, first and foremost, take advantage of the resources now as much as you can to get your system scaled up and ramped up to get people housed. However, a lot of this money, as is implied in the question, is coming down from the federal government. We're not sure if it will continue post-pandemic. There probably will be some shrinkage of this particular funding. However, now is the time to also start reaching out to the philanthropic community and getting them involved in terms of helping them understand what you're currently doing, what you're currently planning, how you are currently using resources, and then also getting them involved now so that you can kind of have them on that back end, that post-pandemic, so that they can then step up and possibly fill in gaps where federal and state as well as local funding resource may begin to shrink back. So if we do see a change or shrink in funding resources post-COVID, start doing that planning now as far as other resources that your community would be able to access, so that you can get that in the pipeline. And this is very important when it comes to the development of affordable housing. We know affordable housing does not come up overnight. And so you want to get this funding in the pipeline now as a part of your planning process and sustaining for the future. Anything you wanted to add, Angela?
I just want to add that we can't say enough how important it is to involve those with lived experience, right? That's something that definitely needs to continue. We need to do a better job of that, I think, in making sure that people with lived experience are helping in that planning, and that should definitely continue post-pandemic.
Yep, definitely. And another question, and this is a great question. Are there any tools or resources for community evaluation and data sharing between various industries such as health and mental health? If you go to our website, www.usich.gov, www.usich.gov, and type in the keyword data sharing, it's going to pull up a number of documents that address the issue of data sharing, because we understand the importance of data, and then the data has to come from multiple systems, so that cross data sharing collaboration has to happen. And so there will be a number of resources there. I also know that the National Alliance has a number of resources, www.naeh.org, www.naeh.org, and type in data sharing, and they will have a number of resources as well. And do understand that is one of the primary challenges that a lot of communities face as far as data sharing across systems is concerned, but we are getting better. So definitely access those two websites for some additional resources. All right.
Take the next question.
Yep. With the ESG CV2 application guideline of ensuring procurement is racially diverse, is there any incentives or disincentives for applicants?
Yes, absolutely. And so those applicants that are able to identify subrecipients that are, led by people of color, that are serving Black, Indigenous people of color primarily, and really connected to those communities where their populations are poorly or underserved, those applicants that successfully identify subrecipients to work with will be prioritized when it comes time for scoring the application. So yes, they will be given priority. And
that's a great question. And, that's very important, because if you look at the way the homeless system is broken down racially and ethnically, and then looking at COVID, Blacks, other racial minority groups are disproportionately impacted by homelessness and COVID. So we do want to make sure that those funding resources are getting out, not only to those populations, but also, the providers that are serving those populations should be reflective of that population. And that tends to not be the case in a lot of situations. All right, next question. I'm getting old, y'all, so I need glasses. Are there any policy initiatives to put the framework into action? Oh, so basically, you can look at it this way. The way the framework was developed, it's rooted in a lot of current policy that has been developed at the federal level that's based upon best practices. So while the framework will be used, and as these national groups as well as other groups push for any additional changes in policy that are needed, it is based on current policy that is based upon current best practices and what we know is working well within communities. Anything you wanted to add, Angela, to that?
No, thank you.
Okay, great. All right, next question. These are great questions. Keep them coming, folks. Post-pandemic, how would our systems look according to both of you? Wow. Okay, so you are asking me to prognosticate and look into the future and see how our systems, well, according to me, I think this whole pandemic was an eye-opener, in the sense that it showed us that we were not prepared to develop and implement an immediate response to a sudden crisis. okay, especially one on this scale. So I think post-pandemic, while I think there will be some things that will remain in place as far as how it impacted the homelessness system and how it functions and operates, I do believe that homeless crisis response systems will now have plans in place so that if we ever face something like this again, we are able to shift immediately. And not only do I see that change being within the homelessness system, but I also think at the level of local, state, and federal government in terms of how can we quickly shift policy in order to respond to an immediate crisis. I think that is now going to be in place so that we are better prepared if this, God forbid, happens in the future. Angela.
So I think my response is very specific to the framework, and really what strikes me throughout the framework as it relates to congregate versus non-congregate shelter, right? I think that's something that we definitely have learned throughout the pandemic, is that congregate shelter isn't the answer, and that throughout the framework, it really encourages that we should be eliminating congregate shelter for multiple reasons, and really looking at how can we implement only non-congregate emergency shelter. And so I when I think about post-pandemic and our system, our homeless system, that's the one thing that really strikes me about this, is that and moving in that direction to provide non-congregate shelter, not only for public safety, but I think it's more appropriate and more comfortable and what our neighbors experiencing homelessness deserve, right? So.
And I think, and I'm glad you mentioned that word, Angela, public safety. I think this pandemic showed us kind of like when the Great Depression hit in the 1930s, that nobody's exempt, that this type of crisis impacts everyone at all levels of society. One of the things that I am hoping, especially because of what we're seeing with the homelessness system, is that becoming homeless is not based upon a moral flaw. It doesn't just impact certain groups of people because of their particular characteristics, but when a crisis and a pandemic hits like this, and people at all socioeconomic levels stop working or they lose their job, now we're all at risk of becoming homeless. It really sends home the message that homelessness can impact anyone, and that we shouldn't have any particular types of stereotypes as it relates to who is homeless, who becomes homeless, or even those reasons behind becoming homeless. And so again, that happened in the 1930s with the Great Depression, and we're seeing that same thing today. So I'm hoping, as far as like maybe a public awareness is concerned, that people are more aware of the impact that a crisis can have on all socioeconomic levels. And so I see in the chat box that there aren't any more questions as of yet. I believe we go until 2 o'clock, correct, Angela?
We do, yes.
Okay, so Angela, do you have any closing or departing thoughts? Because we don't want to hold people, if there aren't any additional questions.
I think I just want to reiterate that, it's important for people in communities to be aware of the framework. And if this is the first that you're hearing of it, take a look, and become familiar with the framework, and start thinking about how your communities can implement the elements of the framework. Because it's going to be important as we're, moving through, the phases of this pandemic, and making sure that we have appropriate and safe housing for those experiencing homelessness. And then also, as we've been talking about, post-pandemic, how can we, implement the framework so that we're strategic and making sure that the resources are available, and we're effectively having an impact and providing housing to as many as possible.
Yep. And keeping a focus, I just want to call out action areas C and D, housing, and then action area D, prevention and diversion. Again, once the end of the month hits, you know, if we do get a moratorium extended, that's going to be great. But at some point, there won't be a moratorium on eviction. And so communities really need to focus on their prevention and diversion strategies and resources. And then also action area C, which is housing. You know, shelters are de-densifying. We're developing non-congregate. We're partnering with hotels and motels to get people, when this pandemic is over and it's time to, kind of shift things. The focus is still on housing. We don't want people to go from that hotel or motel where they were quarantined or, you know, they were sheltered back into shelter or back into homelessness. And so we definitely want that focus to continue to be on housing. And it was requested that I put my contact information back up again. So I'm going to do that now. Let me just pull up the PowerPoint. Let me share my screen again. All right, and give me a second. All right, here's my contact information. And again, if you have any questions about whether it's your local CoC, whether it's about federal policy or funding, maybe folks in your community aren't getting access to housing vouchers as they should, please reach out to me. And if it's something that I can help give an answer to directly, I will, or I will reach out to the appropriate entities to assist you and to get an answer. There's something else in the chat.
That was our 10-minute warning.
Oh, that was our 10-minute warning.
We'll give it just another few seconds to make sure if there's any questions. Otherwise, we'll wrap up.
Sure, no problem. I can share with people in these last few minutes that as far as our work is concerned at the federal level, we have been seeing significant progress as far as decreases within homelessness. If we speak about veteran homelessness based on our 2019 data, we've decreased veterans homelessness by 50%, unsheltered homelessness amongst veterans by 56%. In case some of you are not aware, you know, when we talk about ending homelessness at the federal level, we use the term effectively ending homelessness, meaning that it focuses on the homelessness system and how the system is designed. It's not focused on getting down to a number of 0, which is great, but we know as long as a lot of other systemic issues exist within our society, as long as systemic racism exists within access to housing, healthcare, jobs, employment, etc., we're going to have people falling into the homelessness system. So our definition at the federal level of what it means for a community to end homelessness is based upon how the system is designed. And so we've actually developed metrics, criteria, and benchmarks that focus on how your system is designed and how it operates, so that if an individual or family's homelessness cannot be prevented, it will be rare, brief, and one time. Those are the 3 key terms that we use: rare, brief, and one time. And again, this framework that we just went over is built around these criteria and benchmarks and, you know, this system design that we talk about when we say effectively ending homelessness, so that your system is designed so that people don't fall into homelessness often. So you have those prevention and diversion, action area D, you have those prevention and diversion strategies in place, and so that it's rare, and then it's brief, so that as people do fall into homelessness, they're not homeless for a long period of time. And the criteria and benchmarks have a 90-day average for that as far as your system is concerned. And then it's one time, so that once people do exit homelessness, they're given the necessary resources and supports so that they don't fall back into homelessness again. And so again, for those of you who may not have been aware of that, that we have established metrics at the federal level as far as what it means to end homelessness. And we have seen great progress. We've actually seen decreases across all populations except the unsheltered population. but we do recognize that the data is showing that's in certain pocketed areas, particularly on the West Coast, and there are some specific causes for that, but we have been making great progress. If you want more information or more data on that, or you want to look at the criterion benchmarks, because we have established them for chronically homeless individuals, veterans, families, as well as youth. So we have criterion benchmarks for what it means to effectively end homelessness for all of those populations. Go to our website. And again, when you review the criterion benchmarks, you will see a lot of what we discussed as far as this framework is concerned incorporated in there. Because as I mentioned, the framework was developed around current federal policy that is based upon best practices. So I just wanted to share that with you all.
Thank you, John. Thanks for sharing that specific data. I mean, I think it's important to celebrate those achievements now, right? I mean, during these times, it's good to hear that, we're making progress, and we know everyone's working so hard, and you're making a difference, so.
Yeah, exactly. And we appreciate the effort that all of you, not only the effort you've been putting in prior to COVID, but definitely the effort that you have been putting in, since COVID has hit. We know that a lot of agencies are strapped for staff as they deal with people out due to becoming sick. And so we certainly do appreciate all of your efforts in the work that you all are doing there on the ground. All right, 5 minutes until session end time. Let me see, what can I do for 5 minutes? One of the things that I can do, the question was, there was a question raised about, how do we sustain this, after COVID, particularly as it relates to funding. I mentioned the progress that we've made with veterans homelessness. That's because Congress put up the money. When it came down to veterans, Congress was willing to pour in the resources so that all types of rental assistance, as well as permanent supportive housing programs, can be implemented for veterans. The message that we're trying to send to Congress now is this: look at what happened with veterans when the dollars were put on the table. And so we're trying to push that same argument, particularly for chronically homeless individuals, as well as families and youth. And that's why you have things like the Youth Homeless Demonstration Program, et cetera. We're really trying to get Congress to understand that, look at the progress that can be made when the resources are put on the table. And we're using veterans as that example, because we've seen some good success there. All right, well, to our session host, I think we are wrapping up here. Is there anything that you need to do or say to close us out?
No, you're all set to close out, and I'll share a final.
Okay, it's been great, folks. Angela, it's been good to work with you on this. It's certainly been a pleasure.
Thank you. Thanks to everyone for joining us, and I hope you have a great afternoon.
Yep. Have a good one, folks. Bye-bye.